The big role of public health in this disease really should be contact tracing and guidance to authorities about infection control measures and things like that, and making sure that the most up-to-date protocols are available to guide the people who make decisions about social distancing and mask wearing and things like that.
Some of the longer term actions to dealing with the pandemic, I think one of the things we've seen is the insecurity around healthcare coverage and around access. Those are certainly concerns for us, absolutely, as we've seen how COVID is impacting underserved communities, African-American community. It's just been devastating. And I think those are things that we really need to look at as a country, and how can we address those. So broadening health insurance and really strengthening the nation's the public health infrastructure. Those are some of the long-term things that I think we could be working on. We have shortchanged things. Shortchanged might not be the right word. We haven't made the same investments perhaps as some of our other countries across the world. And so that we end up spending more for paying for sick care as opposed to paying to keep people healthy.
It may not necessarily take money. Here in the state of Florida, we actually have the Agency for Healthcare Administration that administers Medicaid, and we have a Department of Health that is kind of our public health agency for the state. They don't coordinate at all except in the governor's office. So part of this just may be reorganizing our healthcare system within our state, not necessarily needing new funds, though it would be helpful.
Congress deals with things that are, immediate threats. They have very limited money to play with. And so I just don't see it happening. I can see maybe a spike for a couple of years here, but I don't see any kind of permanent commitment to it. Let's improve the health of the community to keep them out of our hospitals. And as you know, I know some of the things we've talked about, Brady, about alternative payment systems and ACOs and so forth. I think those are going to have to come to the fore, and hospitals are going to be in charge of community health. And we got to make sure we construct those new payment systems in a way that makes that a viable option for people. And I think, you can save a lot of money by keeping people out of the healthcare system right up front.